Hi everyone, it's Dr. Elston. Today we're trying a new setup with camera here, and we're going to be doing a screen recording of a presentation. This presentation is going over the different types of lipedema that we treat. So different patients come in for different reasons. Some of it's cosmetic, some of it's reconstructive. We treat all different types of patients with lipedema from head to toe. So today we're going to cover a few different types of patients, and I hope that you can find something that you relate to in this. If you find something that you think is interesting, please comment about it, and please feel free to share this video. So without any further ado, so lipedema can come in all different shapes and sizes. Surgical plans for these patients are always custom. So it's not just like a one size fits all treatment. A lot of times we're taking into consideration where the patient lives, the logistics of who's going to take care of them during surgery, as well as what are their highest priorities for what types of areas that bother them the most. So some plans aren't suitable for some patients. So, someone may need to be done in the hospital because they're not healthy enough to have surgery in the clinic. Other patients are horribly afraid of having surgery awake and they absolutely want to be asleep and not remember anything. So, for certain patients, certain plans won't be relevant. For the most part, it is a custom treatment plan, and we can often base it on the patient's preference. So where to perform surgery? As I discussed before, we do most of our surgery in our office-based surgery center. So that means that you get minimal sedation. There's no IVs. There's no breathing tubes. That means that you're aware of what's going on. You're able to kind of tell me, hey, I'm starting to feel that pokes a little bit. And you're also just able to like laugh and let us know how things are going. Most of the day, we spend having a conversation. The surgeries generally take somewhere from 2 to 3 hours. And we're just kind of talking and laughing with you most of the time. Some patients really enjoy this because it gives them the ability to know what's going on, know who's in their surgery, and it's not like me leaving the room and my assistant comes in and takes over for me. It also allows them to have a lot of agency over their final result. They can look at something and say, hey, that looks kind of different than the other side. Do you mind treating a little bit more? And for some patients, it's also just good to look and see like the stuff coming out of the tube, the stuff that's in the container afterwards, and they can say like, "Wow, like I know that it really came out." And it often helps kind of skip them to start feeling better and thinking that they're going to feel better. Another area where we do surgery is in the ambulatory surgery center. So that's kind of like outpatient surgery, more of what you would think of like, you get a breathing tube, you get an IV, you go to sleep, you don't feel anything, you don't remember anything. Some of the downsides to that or surgery in the hospital can be that you can have pretty significant nausea and vomiting afterwards, which isn't the end of the world for everyone, but it can be a pretty negative way to start your recovery. Some patients don't like the idea of going to sleep, so for them, that's not really something that they're interested in. Um, but it can be a really safe option, and for most of our skin removal procedures, that's what I typically recommend as surgery under general anesthesia because it's just a little bit harder to get the skin comfortably numb to do those larger excisions. Finally, our last place that we do surgery is in the hospital. So that's typically reserved for patients that are a little bit more sick and they've got medical problems or they're needing high volume liposuction. And legally, we can't take out more than 5 liters in one single session. So we would do it at the hospital and have a patient stay overnight. So our first patient, this is kind of a classic cosmetic lipedema patient. So she's got stage 1 lipedema. It mostly bothers her in the arms, and it's more of a cosmetic problem. She doesn't like how it fits on her sleeves when she wears shirts. She doesn't like holding her arms up. And she is starting to feel like a little bit of tenderness when she has her blood pressure taken and things like that. So this is a young mother. She lives out of the country. She's not eligible to use her health insurance here in the United States. And she has mild symptoms. So this is kind of an ideal patient for self-pay because they're looking for like a one-off procedure. They're most likely not going to need to do surgery in a hospital or a surgery center because it's a really small area, and they tend to have a very, very rapid recovery. So that's her pictured after about 2 weeks, and you can see she's already had pretty significant retraction of the skin and snapping back. There's still some bruising in place, but this is a really good option for this patient because she can't use her insurance. She wants to keep costs low. She's healthy, so she doesn't have to be done in a surgery center. And really, she's not able to take a whole lot of time off of work because she's a young mom and she's got her kids that she needs to take care of. So she wanted something that got her results fast, didn't cost that much, and got her able to be back to being mom as early as possible. Our second patient, this is a 41-year-old female that I actually did fleur-de-lis abdominoplasty on about 5 years ago, and she came back with persistent symptoms of lipedema in her lower extremities. This patient had a history of weight loss surgery, and she's got really no rush on her timeline. So the interesting thing with her is that we did 2 rounds of liposuction to debulk the legs as much as possible. Because we can only take 5 liters in a single session, this patient had 2 separate surgeries where we took 5 liters from the front and the sides, and then 5 liters from the backs and the sides of the thighs. And you can see here in this photo on the left, she's got pretty significant skin laxity and loose skin, and she wanted to ultimately get the best contour on her legs. So she knew she was going to need skin removal to do that. But again, like when you're having 2 or 3 surgeries, you want to try and keep your costs down as much as you can. And I personally don't like to do skin removal surgery at the same time as the liposuction. Once you do the liposuction, the legs and the arms swell like crazy after the first week or two. And if you've got a fresh incision on that area, that incision wants to tend to pull apart. This patient had a prior brachioplasty by another surgeon, and the thing that bothers her the most is the scar. The scar is so wide and it gets so red. So I prefer to stage my liposuction and my skin removal surgery. So that way you deflate the arm, you let all the swelling kind of take place, and then when you remove the skin from the arm, you get a much nicer scar because you don't have that significant swelling like after the liposuction surgery. So she knew that she wanted to do that, and that would have to be done at a surgery center, which can cost significantly more. So we did the first 2 rounds of liposuction in the office because she's pretty healthy and she's young. And then ultimately we went to the surgery center and we did bilateral thighplasty or thigh lifts, which is a skin removal from the thigh. Um, she has incisions on the inner parts of her thighs, which when you're looking at her from straight on or from the back, you can't really see it as well. But when you do look from obliquely, you can see that she's got a pretty fresh scar here about 6 weeks out from surgery. So it's still kind of pink, still kind of purple, but it will soften over time and fade over time. But I think, when you look back from what she had with the loose skin to here, it's a much nicer and prettier result. This brings us to our last patient in this presentation. This is a 45-year-old female, and she kind of represents like the classic lipedema, where you have the severe ankle cuffing. She's got a lot of heaviness and a lot of extra bulk. This patient has difficulty walking because her legs are just so heavy. She definitely wants to use her insurance, and this is really affecting her functional ability to do work and to get around and to exercise. And she wants as much impact as possible. So this is a patient that's a great candidate to do surgery in a hospital setting. We're going to do high volume liposuction, so we're often going to take 5, 10, sometimes up to like 13 liters. And that's going to take a lot of the weight off, about 25 to 30 pounds in a single surgery. So it's going to make things significantly easier to move. But we also know that with a patient like this, she's definitely going to need skin removal. So we want to do the surgery in the hospital to get the maximum impact so that we can then get to the stage where we go and we remove the skin. So the more that we can take out initially, the quicker we get her to skin removal, which we know is going to be the ultimate in game for her. So this is her after one surgery. So we removed 13.3 liters in the hospital. She has 7 surgeries covered by her insurance. She's since done second one, she has her third one coming up. But this patient was okay with a prolonged recovery. She was okay with a higher risk of complications because she did need that big impact right away. So this is her after about 6 weeks from surgery, and you can see that we did the liposuction on the front of the thighs, the knees, and the legs, and you can see where she still kind of carries the heaviness on the back of her calves in particular. But already this patient has significant improvement in her heaviness and her tenderness and her ability to kind of get around. So I hope this presentation was helpful. These are just some kind of quick cases that we do and the types of patients that we see. Again, we take patients that are all different stages of lipedema from all over the country and out of the country. Um, every treatment plan is custom. So we're always listening to the patient's story, trying to figure out what bothers them the most, what they want to get treated initially, and then also like what's the most reasonable venue to treat them to make them feel better. So I hope this presentation was helpful for you. If it was, please feel free to leave a comment below. Or if you have questions about lipedema, sometimes we can answer them through the comments here. We do virtual consults for our patients. So if you're someone that has lipedema and is interested in getting surgery, please call our office or fill out an inquiry on our website to do that. If you found this information helpful, please consider sharing it with someone that you think might need to know about it. Or if you want more information about lipedema, we have other videos like this one about compression that we recommend after surgery, and this one about how we actually get you numb if we're going to do surgery in the office awake. I really appreciate your time and attention, and I hope that these different angles were helpful. It's nice to be able to look around. It feels like I'm presenting to an audience rather than to just cameras. So again, I just want to say thank you. I'm Dr. Joshua Elston. I'm a board certified plastic surgeon that specializes in lipedema surgery, and thank you.